Let's talk about the pulse. Every time the heart beats, it throws blood out, and we can feel that blood. Those are arteries. We feel the arterial pulse, the radial pulse. There's a bone, there's a ligament, right between there is a little valley. That's where you can feel the pulse. Normal pulse is between 60 and 80. When it gets over 100, it's too fast. When it gets below 60, it's too slow. If somebody has a pulse, where else can you feel it? There's one in the temporal artery, there's one in the neck. Never feel both arteries at the same time in the neck. You'll cut off the blood flow to the brain. In the groin, there's an artery there. Behind the knee, there's an artery there. On the top of the foot, there's an artery, and behind the ankle, there's an artery. So the best ones to feel are the radial artery and in the wrist, and also the carotid artery in the neck. Now, what can it tell you? If the pulse is nice and dynamic, if it hits the tips of your fingers right there, and you can feel it nice and strong, that means your heart is really pushing out blood good. That's what you want to feel, a nice bounding pulse. If it's sort of a weak, thready pulse, if it's sort of, you can just barely feel it, and it's going, you can feel it, it's going bang, 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 but you can barely feel it. That either means your heart's not pumping out blood good and you're not in shape, or it could mean, if it's real fast and real thready, it could be a clue to the doctor that you've got anemia. If it's bounding and fast, it could be that you've got thyroid disease and your pulse rate is fast and it's going bang, 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 bang at a much faster rate, 110. So know how to count your pulse. That will tell the doctor in itself. Know the character of your pulse. If you're having fluttering of the heart, try and take your pulse when that's happening, because you can tell the doctor if your heart is racing for a period of time, how long that time is, what your pulse feels like. If it's irregular, you can feel atrial fibrillation. If you're having bigeminy, that's a good pulse and a missed pulse, or a good pulse and a missed. You can feel both of those if you really pay attention. So start feeling your own pulse. See if you think your heart is beating as strong as it should be. See what you can do to help your doctor by knowing that pulse. The other diseases, aortic stenosis. As the blood is having a hard time coming out of the heart, guess what your pulse feels like? It's real weak but real long, because the heart is having to take more time getting that blood out of the heart. If you've got aortic insufficiency, the blood comes back into the heart from the aortic valve, and so there's more. So you got a bounding pulse, a real strong pulse. So know what your pulse is, know that it can help your doctor.